This is a really important time for the NHS and an important time for the Commissioning Board. It's the first time in the new system we can set out the planning guidance, the allocations and the tariff arrangements for the NHS going forward. Three vital things to enable people to plan and organise services in 2013-14 in the most appropriate way. What we want to do in terms of the publication of this suite of guidance is to give the NHS the best possible start, the best possible way of ensuring that we can get great outcomes for our patients. Purpose is really important when you get into the details of planning guidance, and to be really clear that what we're trying to do here is to get great outcomes for our patients, to enable patients to be involved and participate in their healthcare and the way the NHS operates, and to give clinicians a real leadership position in terms of commissioning services. And that's what we're trying to do, and it underpins all of this planning guidance. Now, if you understand the outcomes framework and the NHS Constitution, you've broadly got an idea about what this set of planning guidance is all about. But we're also trying to say, what is it that the Commissioning Board can do to help and support organisations get great outcomes for patients? And we're making 5 offers to the NHS as a Commissioning Board to help and support this happen. We want to focus the NHS's attention on 7-day working. And the Medical Director, Bruce Keogh, is going to lead some work to see how can we get a much more customer-orientated NHS, but also an NHS that operates services over a 7-day basis in order to improve outcomes for patients. Secondly, we are going to put arrangements in place to publish information about clinical activity by consultant in a whole series of specialties. We plan to do it in the summer, and we plan to make sure that that is carried on by providers in 14-15. Thirdly, we want to increase patient participation in the way in which the service operates, and by putting a series of measures in place which will help and support that. So the friends and family test, so every organisation starts to get real-time information about what patients think about their services and how they can best improve them. Fourthly, we want to ensure that professional leadership is absolutely part of our planning guidance. That's why the Chief Nursing Officer's strategy is a part of it. The push on medical revalidation led by the Medical Director, the work the Leadership Academy and the Improvement Body are all going to do to help and support improving the services and outcomes for patients. And finally, we're putting a lot of effort and time into better data. Data is the thing that will drive things. When we, some time ago, thought about what makes high-performing clinical teams, we concluded that great performing clinical teams measure, they improve, they benchmark, they set themselves goals. That is underpinning all of the work that we do in the planning guidance. But to do that, you need really good data. So we're setting ourselves to significantly improve the data quality, but also being much clearer with organisations about what the expectations are. We think the planning guidance with those offers will make a real difference to patients. It's a new way of operating, it's a new way of taking the NHS forward, and I'm confident we can make a real difference for patients.